Hi, everyone. Thanks for joining us tonight. This won't be a very long session, but Malcolm has been poring over the recent research published by Dr. Dean Ornish nearly 2 weeks ago now. And we just thought we'd share it with our followers and then maybe just chat. Won't take long, but chat a little bit about the media coverage of such groundbreaking research. So
yes, this was research published by Dean Ornish and a group of authors, published on the 7th of June. And it was about the effects of intensive lifestyle changes on the progression of mild cognitive impairment or early dementia due to Alzheimer's disease, a randomised controlled clinical trial. It's groundbreaking research. The reason I say that is that we've had lots of data for many, many years looking at the risk factors, looking at things that are more or less likely to lead to Alzheimer's disease, which, if you listen to the experts about this, is a disease that's genes can be a factor, but it's largely lifestyle driven. And the importance of this study is previously we've known about all these factors, risk factors, lifestyle, diet, that may lead to Alzheimer's. But this is the first study that's actually looked at diet and lifestyle on people who already have Alzheimer's disease at the milder end of the spectrum, the mild dementia, the mild cognitive impairment, but a definite diagnosis of Alzheimer's disease. And found very positive results, which is groundbreaking. In fact, the results, I think we could say, is better than the drugs that we've got. We've recently had the TGA in Australia approve a couple of monoclonal antibody drugs, lecanemab and donanemab. And these have been released on the market at great expense, and some of the doctors will be looking for subjects to try them out on. In an article in the Australian Prescriber talking about giving an independent review of these drugs, they noted that the drugs did remove the plaque from the brains, the amyloid plaque from the brains of people, did seem to do that. But in terms of the improvements in cognitive function, the article noted that these did not reach a level that was the minimum clinically relevant amount of change. That is, they caused some statistically significant change across the group, but it was like pretty small. And the drugs can cause brain swelling and hemorrhages, so they're not entirely safe. So what have our media said, our public media and our medical media in Australia, about this groundbreaking research by Dean Ornish? Yeah, that's exactly what they've said. I have not seen a single reference to it in any of our medical organisations or our general media. Meanwhile, these drugs that have been recently approved have had quite a lot of media attention, quite a lot of medical attention. So this is just very selective media coverage. And I don't think we have to dream up conspiracies or interest groups for these. I think it just shows that we're very much focused on pills and drugs to fix our problems rather than lifestyle.
Though I often say it's the reason that a lot of this stuff, a lot of research reaches particularly the mass media, is because of the press release, and no one in Australia has obviously been putting the effort into the press release because there's no big money behind.
If this research had shown that a particular some products from a particular food industry, I won't give any examples here, had this sort of anything like this effect, they would do a media launch and a promotion, and it would spread across all of the media. Anyway, most of you will be familiar with Dr. Dean Ornish. one of the sort of founders of the whole lifestyle medicine movement, publishing his a lifestyle heart trial in 1990, proving for the first time that you could actually reverse artery blockages in the heart with lifestyle alone. And then later on doing another study of low-grade prostate cancer, showing that you could effectively halt the growth of this cancer. So to describe this study, this was a 20-week study. Well, it was a randomised control study, which means you enroll people. They'd wanted to enroll about 100, but the pandemic came along, so they only enrolled 52. And to be in the study, you needed to have a definitive medical diagnosis of Alzheimer's disease at the milder end of the spectrum, and have a spouse or carer person who could work with you to help you put the program into place. It was indeed an intensive lifestyle program. Dean Ornish threw everything he knew at these subjects, because Dean Ornish is a lifestyle medicine person. He doesn't just do nutrition. He's a lifestyle medicine proponent. And they instructed the control group not to make any changes. And they gave them a little promise. They said, don't make any changes now. And if you want to, at the end of the 20 weeks, you too can do the program for free. So what did the program involve? Well, there was a dietary arm of the program, and that was a whole foods, minimally processed, plant-based (vegan) diet, with fruits, vegetables, whole grains, legumes, soy products, and some nuts and seeds, especially low and harmful fats, sweeteners, etc. At the low fat end of the plant-based spectrum, with 14 to 18% of calories from fat. Many of you will be familiar with this diet. This is like a sort of low-fat, whole foods, plant-based diet. However, in addition to this, there were some supplements, and we're minimalist with supplements. We take B12, and at times of the year we take vitamin D. This program used an omega-3 fish oil supplement with curcumin. It used a multivitamin without iron, coenzyme Q10, quite a big dose of vitamin C, some vitamin B12, some magnesium, some lion's mane mushrooms. Has anyone tried cooking those? They're delicious. And a probiotic. So I guess when we looked at that, we thought that's a pity, because although none of these supplements on their own have been definitively shown to improve cognitive function, the whole pattern of having all of those in there means that the results of the study, there'll be a question mark over was it the lifestyle and the nutrition? Did the supplements, were they a necessary part of the program? Then there was the exercise component. Again, fairly intensive. For this group, these were older people who weren't fitness buffs like Jenny, who took me for a gut-busting swim session this morning. They were walking 30 minutes every day, and there were at least 3 supervised online strength training sessions per week. So for this sort of group of subjects, this was fairly intensive. Then there was stress management, 1 hour a day with some supervision, and this could be meditation, some yoga poses, breathing exercises, visualizations. So that was also quite intensive. And then there was some group support where, they'd all meet online. And, effectively with the Zoom sessions, they effectively did, I guess, an online Ornish program. And that is 3 4-hour sessions per week on Zoom. Sounds exhausting to me, including an hour of exercise, an hour of stress management, an hour of just supporting each other, and a lecture thrown in there as well. So it was an intensive program, and did include a whole foods plant-based diet, but it included much more. When you start, before you commence a large study like this, you need to announce what your primary outcome measures are. That is, you can't say, look, we're going to do this study and we're just going to measure 200 different things, and whichever things come up as statistically significant, by chance alone, if there's that many things, then we'll go on them. You can't do that, because, it could just be you picking out the ones that just happened by chance to be positive. So they selected 4 standardized dementia tests, that is, assessment scales that measure cognitive function, cognitive and the function of the person. So these were standardized dementia tests that are commonly used. For secondary outcome measures, they measured a whole lot more things. They measured quite a few things in the blood, and they measured the gut microbiome. When the results came out, for the statistics buffs, one of the measurements was overall what they found was in 3 out of 4 of these measures, the subjects in the lifestyle group actually improved, whereas the subjects in the control group got worse. The 4th measure, everybody got a little bit worse, but there was less progression in the lifestyle group. As far as the statistical significance goes, 3 of the 4 tests were less than 0.05, and that's the accepted probability level, less than 1 in 20 chance that it was by random chance alone, and the accepted sort of level of statistics. And the 4th one was was around about the cutoff mark, so it wasn't statistically significant. It was borderline. And to find statistically significant results in a small study like this, with 52 subjects, and a couple of them very early on in the intervention group said, no, we can't handle the diet. So they ended up having 24 subjects in the intervention group and 25 in the control group. Normally, you'd need a very large number of subjects, and then you can show statistically that it wasn't chance alone, that your drug did indeed have a small benefit, and you're very certain about it. To find a statistically significant improvement in such a small study, small number of subjects, means that you must have had a very powerful treatment effect that you're measuring. Breaking it down more to individuals, if they look at the 2 groups, the lifestyle group and the control group, in the lifestyle group, 10 of the 24 improved, 0 in the control group. No change, about the same number in both groups, 7 in the lifestyle group, 8 in the no treatment group. Got a little bit worse. Yeah, there were 7 in the lifestyle group, but 14 in the no treatment group. Got much worse. None of the lifestyle group did, but 3 of the intervention group. And if we focus back on those 10, that's 40% of the lifestyle group in the study actually had an improvement. And if you go online, actually, Dr. Michael Greger's done a couple of 2 or 3 testimonials from some of those subjects where the changes that they experienced were life-changing. They could do things that were meaningful to them that they hadn't been able to do for a long time. I don't know if I don't think they applied the same, minimal clinically important differences that measure that was done with the drugs that I talked about. Also in this study, there was a dose effect. As in Ornish's previous studies, those who adhered most closely to the lifestyle recommendations, and they sort of had a scale to sort of estimate and ask people and try and measure that. Interestingly, that the scale, there were some subjects who were over 100%. There'd be subjects who did even more exercise than they were instructed to, or ate even more broccoli or whatever it was. But there was a relationship in the higher the adherence, the better the individual result. And there was one experimental blood marker for Alzheimer's disease, and overall that went down in this marker for Alzheimer's went down in the lifestyle group. It went up in the control group, and it improved more in the subjects that had a higher adherence. I think of particular note in the secondary outcomes, the blood measurements, was the lifestyle group reduced their LDL cholesterol by 31%. That should translate into a huge reduction in heart risk, and is the sort of result that you'd expect by putting someone on a statin cholesterol drug. So I think in summary, this is a groundbreaking study that showed for the first time that an intensive lifestyle program can actually improve the cognition and function of people with mild Alzheimer's disease. Now, we're pretty, there are some people who might be parading the study as evidence for what a whole foods plant-based diet can do for in terms of reversing disease. It's not entirely accurate, because, as I've explained, this was quite an intensive overall lifestyle program. It wasn't just a whole foods plant-based diet. From our perspective, we very much regard, I'm a lifestyle medicine practitioner. We run lifestyle medicine programs. We certainly consider the low-fat, SOS-free, whole foods plant-based diet as being like the keystone of all the lifestyle factors. If you get that right, you'll usually do well. But it's not the whole story. And so when we run our immersion events, our 7-day immersion retreat, for example, we give a lot of emphasis to whole foods plant-based nutrition. But we also have a functional fitness and aging specialist who talks about exercise and helps people to sort of plan an exercise program when they go home.
And we plan an activity every day as
We
well.
have an activity every day. We have someone talk about stress management and mental health, and the centre we run it at has a beautiful low stress nature environment, and also provides meditation sessions. That's about all I have to say about this study. I very much hope that I see this study talked about more in Australia's medical media, medical groups.
But we're not very optimistic.
No,
given
not
that
very
it's,
optimistic.
Coming up for 2 weeks. I think it was 12 days ago that it was published.
Dr. Michael Clapper
No.
has used the term in the past, how doctors develop
Pharmacosclerosis.
Pharmacosclerosis, not hardening of the arteries. It's like hardened into a way of practicing medicine that's all about prescribing different pharmaceuticals.
So if anyone watching wants to ask us any questions, please pop them in the chat, and we can stay online for a couple more minutes if there's anything you want to hear from us relating to this study, or any other questions. Happy to answer. It's hard to know if anyone's busily typing. Anything else we want to share that we're up to? Our next immersion retreat in the Yarra Valley is in September 8 to 15. And we hope to get together a small group. We often have about 12 people. It's never really, or rarely any larger than that. And so it's a very a lovely, supportive small group.
We certainly get the group dynamic. The group part of the intensive lifestyle seems to develop very quickly when you have a group of like-minded people working together.
Okay, well, I'm not seeing any questions coming, so maybe we'll finish up. So thanks, Alex, and can't remember, Anita, what comment that was about the bonus, but something Malcolm said. Forget what it was.
Maybe it was the cholesterol falling by 30, the LDL cholesterol falling by 31%.
Okay. Are we seeing a lot of reversal of plaquing and heart disease with the presumably that's the Esselstyn diet?
program?
Indeed.
Yeah. Look, I see people who I see as patients, people who come to the immersion, who have quite severe plaque in their arteries, and it sometimes worries me. They're taking a lifestyle approach, but generally they're sensible. If their blood pressure won't go down enough, they'll take a blood pressure tablet. And yeah, I've seen people who are lined up for bypass surgery, non-urgently. It's a different matter when someone wants to do a stent or bypass, urgently as an emergency to save someone's life. But and instead they do an Esselstyn type program, and after a few months, their angina goes away, they feel better, they can walk faster. So in my experience, it does seem to work. Did the study highlight...
Just before you go on to that one, you have had one patient that actually had an angiogram, didn't you? Anyway, I'm sure there was one. I remember the person called me up to tell me how well he was doing.
The cardiologist did a follow-up angiogram, and he actually improved rather than worsened.
And he hadn't attended our immersion, but he had attended our 4-part webinar series, and that sort of kick-started the dietary change. So it definitely makes a difference. So there's the question, did the study highlight any vegetables?
Look, in the write-up of the study, it doesn't give too much detail there, except that the sort of foods they were encouraged to eat more of, and that they really wanted to... Dean Ornish really wanted people to do it. And so subjects were supplied with food. It says that twice a week, we overnight ship to each patient, as well as their partner, 3 meals plus 2 snacks a day. And if the person had higher calorie needs, then we also, we just shipped a bit more to them. So the study participants were supplied with quite a lot of the food, but I don't know whether it's in the publication. It doesn't actually, say whether they were encouraged to eat more leafy green vegetables, for example, as is part of the Ornish, the Esselstyn program.
Now we've got a question here, which is really could be the subject of another live stream. What's our view on fasting, like the True North approach? And that'll make us smile because
that'll make me look really scared.
I've been to True North about 7 years ago, and I've managed to talk Malcolm into going back.
That's why I'm looking terrified.
Going there in a few months, so just to do a short fast, so. Fasting, like water-only fasting, can have incredible therapeutic effects, and so maybe I think when in September we'll actually do a live stream from True North if we can get the time zones right.
Yeah, we'll try and do that. I might be looking rather pale and weak, but we'll see. And someone said, when's the best time to do a follow-up angiogram? I mean, the best time is to never have to do another angiogram again, because, angiograms, do carry significant risks. So, I would leave that to the cardiologist to decide that. When someone does a major dietary change to an Esselstyn Ornish type of diet, there's some effects within a few weeks where the arteries are able to dilate better. So often someone's heart pain will improve within 2 or 3 weeks. Too early for the arteries to have really sort of unblocked. I think that's a process that takes many months. So you'd expect that maybe 1 year later you'd expect some changes. In Dean Ornish's original lifestyle heart study, they did angiograms 1 year later and 5 years later.
Okay, so yes, Sorry, Alex, coming back to your question about fasting. Yeah, we haven't said much, but we're very supportive if it's done in a supervised, anything longer than a few days. You should have medical supervision.
We also question whether everybody needs to fast or restrict the time of feeding. I mean, it's always a good idea not to be, eating in the hours before bed. I was going to have some supper too, but I think the key thing is to be eating a healthy, whole foods, plant-based diet. We would say at the lower fat end of the spectrum, and eating lots of those vegetables. And I think most of us, if we do that and we're otherwise in good health, then how much extra benefit is there from fasting? Well, there might be some.
Well, we do see it, and we even, I even witnessed it when I was there in 2017, I think it was, of people who have already been eating a whole food plant-based diet, very good quality diet, that there are added benefits from doing a water-only fast. There's a question about if you're interested in fasting, what happens if you're already taking medication? Well, that is problematic. So
it can be like if they're blood pressure meds, they probably take you off most of them in the first few days. If you had type 2 diabetes, just on 1 or 2 meds, it'd be the same thing. If you're on insulin, they'd say no to fasting. If you're on thyroid tablets, they'd probably cut them in half. And there'd be a whole lot of other medications where they'd be more likely at True North Fasting Centre to say, no, just eat from the buffet, no to fasting. So that they're careful not to hurt anyone. They've never killed anyone.
So anyone interested in going to True North in California, after you fill out all the forms, you will be contacted by Dr. Alan Goldhammer, who will, have a good discussion with you about whether you're right for fasting. So, to some extent, they'll make that decision. And on that, I think Dr. Alan Goldhammer's got a new book out, and there's a podcast
coming out in September.
I haven't yet listened to.
Fasting Save Your Life by Alan Goldhammer and someone else, coming out in September. Someone's asked about a particular medication. I'm not sure what they do with that one with fasting. They might just say that they'd probably say stop it.
There is a facility in Australia, very small, and if anyone's interested, get in touch with us and we'll connect you to the person who runs it, who is trained with some of the people that involved in True North. And so as I say, there is the option of doing it in Australia at a very small fasting centre. So yes, Beverly, we'd love to see you come to our retreat. We've got one in September. We've been doing 2 per year the last couple of years, so love to see you there. Okay.
Well, we might finish up at that point and not drag it out like some radio show when we're trying to chat to fill in time. And we're not sure what we'll talk about next, but there will be further live streams coming.
Okay.
Good night.
Good night, everyone.